Hey guys, welcome to the skill subcutaneous medication administration, otherwise known as subq, which is commonly called. Now let's take a look at the equipment we're going to need. You of course are going to need your medication. This is commonly going to be in the form of maybe heparin, for example, that's a blood thinner, or insulin for a patient that's diabetic. That's a really common subcutaneous administered medications. Also next, you're going to need a syringe. So just note, this is going to matter depending on the medication you give. So you need to make sure that syringe isn't appropriate. Now what I mean by that, if it's insulin, we have a special syringe that we use for units, that's marked in units, that we use for insulin. So just make sure you check this before you go to administer. And of course, we're going to need our needle for injection. Now this is going to vary depending on the device you use. The gauge, meaning the diameter of the needle, is going to range anywhere from about 28 to about 31 gauge. So I know this is quite of a range, but again, it just depends if it's insulin you're giving or what kind of medication you're going to be administering. Take a look at the length here. This one's pretty short. 1/2 inch is pretty long, but 5/8 is also very common in needle length. We're only going into the adipose tissue, the subcutaneous tissue, so the needle can be much shorter. Now a tip, just remember, we're talking about gauges here, and the higher the number, the higher the gauge, the smaller the diameter of the needle. And again, as you see here, it's a pretty high number for the gauge, so it's a pretty small diameter for this injection. Of course, we're also going to need our antiseptic pads for cleaning. You may need a gauze pad if the patient bleeds a bit, just to kind of compress that area. Now let's take a look at subcutaneous injection sites. This is an important piece. So if you take a look at this image here, you see all of these green highlighted areas. Now, some of these, as you can notice, aren't probably the most preferred. For example, you see on the back side, the posterior, the patient of this image, we really don't inject here that much. But the most common subcutaneous injection sites you're going to use is the back of the arm. And the image may be a little confusing here, but make sure you know you're going to go into the subcutaneous, the soft part of the back of the arm for a subcutaneous injection. Now what we're going to give here, more than likely, is going to be an insulin injection if the patient prefers. Also, a very common and a safe injection site, as you see here, is the abdomen. This is safe because if a patient gets a blood thinner, for example, we're going to give it to the abdomen. Also, the insulin, this is a great place to put insulin as well, is in the abdomen, in the subcutaneous tissue. One key note about administration of a subcutaneous medicine, that's a blood thinner. So if we can avoid it, we really don't want to give a blood thinner in the back of the patient's arm, because if they're in bed, they may rub here and this may cause bleeding or bruising at this site. Don't forget to verify your medication using the 7 rights of medication administration. And next, we're going to take a look at drawing up the medication from the vial. Hi, let's take a look at drawing up a subcutaneous medication injection. So first of all, I want you to note that I am not wearing gloves. Now you may have a question about this, but we are actually not providing direct patient care at this point. So therefore, needing gloves is not necessarily a requirement. Also, if you do want to wear gloves, that is totally okay. It's going to depend also on the type of medication that you are drawing up. So just keep that in mind as well. Also, when we draw up medications, we are typically drawing up the medications in the medication room, so therefore we are not close with the patient or not in the view of the patient. So that also helps as well. All right, so first of all, let's take a look at our equipment. We've got a very common subcutaneous medication injection needle. This, if you remember from previous, is an orange cap, which this typically means that we are giving an insulin injection. When you see an orange cap, this is something to think of insulin. The great thing, it's a great safety device, it's a great safety notification for us. Anytime you see an orange cap, think of an insulin needle, and that should be the only thing we draw up with this. All right, so we've got our needle. Also, we've got alcohol prep pads, and also I've got my vials of medication. So one thing I want you to note before we draw up. So we've got two vials here. One of these, as you can tell, is our insulin. Now, however, this one does not have a top on it, like this one here with the blue. So anytime you go give insulin on your unit, it's very common that this is a multi-use vial. So just know that the cap, like this, may be missing when you go to get your insulin. Or if you're opening up a new vial, you may have one that looks like this, that has some sort of cap like this, and before use, you simply just pop it off. I'm just going to take my thumb here, push it, and it very easily pops off for you. So again, these are multi-use vials, so even if I pop off the cap or the cap is missing, we always want to clean the vial off first before we puncture it. So I'm going to do that now. I'm just going to take an alcohol pad, and we're going to use this one for today. So remember, even if the cap was on, I would still clean the vial. There could be dirt, there could be debris. We want to clean this off before we put our needle in. So I just take my alcohol and rub this vigorously, clean off this top, and let that dry. So now I'm going to take my needle, open this up. Okay, so here's something to think about in regards to drawing up medication. First thing is first, we want to pull back on our plunger, and then we want to pull back air. That's right, I said air. Reason being is once I puncture or pull this back, I put the air in the vial. This is going to help us draw our medication up better. So I'll show you what I mean. So let's uncap the needle. I've got my air pulled back. And notice when I do this, I'm going to try to steady my hand and be very conscious of not accidentally sticking myself and sticking the vial. I like to rest my hand like this just so I'm very careful. So I put the needle all the way in the vial. Then you see me push the air into the vial. Now, there's some debate about this. Sometimes your nursing instructor may tell you you need to put the exact amount of air of the exact amount of medication that you're going to draw up. Really, the purpose of this is just to make sure that that medication pulls back smoothly. It helps provide that pressure for that to fill the syringe when I turn this over to draw up my med. So that's really up to you. So now I'm going to take this hand and flip this over. So I'm going to pull up 5 units, and units because I'm using an insulin syringe, and insulin is typically in units. So now I'm going to take this, and notice that I have to kind of use both hands. There's a little bit of dexterity here. So I'm going to take the plunger and slowly pull back this insulin amount, and you can see it fill up the top. So this is a great tip for you. What I typically like to tell students when they're learning this skill is if you pull back more medication, as you know, while I'm still in the vial than you need, this will help eliminate air bubbles that you're going to pull up in your syringe. All right, so I've pulled all the way down to at least past the 10, but I only need 5 units here from my medication order. So you will see me slowly push this plunger back up all the way to that 5. So now I have the medicine that I need. So I'm going to push this back down. I've got my needle. Now you notice my needle is exposed. Here's what we do not want you to do is take this cap and recapping in the air. As you can imagine, I could stick myself, I could miss. This is what we absolutely do not want, and it's really prevalent that nurses get needle sticks in the hospital. So we need to be really careful about this. So the appropriate way to recap your needle, if you're in the medication administration room preparing your med, is to use the one-handed scoop method. So note that I'm going to take my hand, I'm going to place the needle inside the cap. It's really important that I don't put the needle on the table because this is sterile. So now you see me place the needle in the cap. I've scooped the cap up. And also, this is a very fragile needle, and you never know, this could also puncture the cap. So I recommend taking your hand on the sides of the cap, not on top, and pushing this down to securely until you hear the click. Now that we've drawn up our medication from our subcutaneous injection, we're going to now do the injection itself. So first, make sure you expose the administration site and clean that with an antiseptic pad. Usually that's going to be an alcohol swab. So now let's remove the protective sheath of the needle. So now we're going to use our non-dominant hand and grasp the skin around the injection site. So really here, all we're doing is taking that hand and kind of plumping up the skin to give us a nice surface area to inject. What we don't want to do is pinch really narrow because our hands can get in the way, or we don't want to pinch really hard because that can be uncomfortable for the patient. Next, we're going to take the needle and do it and inject in a very quick, smooth-like motion. So we have options. You can either go at a 45-degree angle or a 90-degree angle. So something to note, most of your patients of a healthy weight or maybe even a higher body mass index, you can go a full 90-degree angle because this is safe, and also remember how the length of those needles are, they're pretty short. Also, sometimes you need to consider you may need to use a 45-degree angle technique. Now this is less common because this is really going to be used on the patients that are maybe even emaciated, really underweight or under body mass index, or someone that's malnourished. So 45-degree angles injections are more rare. 90-degree angles are really going to be what you go by, and usually the most common. So now we're going to inject the medication and then release the skin held by your non-dominant hand. Then we can remove that needle quickly and smoothly and make sure we activate that needle safety promptly to withdraw the needle and make sure that needle is safe and covered and out of the way. Now that we've drawn up our medication, let's take a look at the actual injection itself. We want to make sure our patient's nice and comfortable, then we're going to choose our injection site. Now for this demonstration, I'm going to use the abdomen. Alright, so then I'm going to expose the site, but also try to leave the patient as covered as possible. So I only need to expose a little bit of the patient's abdomen to give this injection. So before I give the injection, I want to assess the site, make sure there's no wounds or scars on the place that I'm going to inject. Typically, we want to go at least about an inch out from the belly button, and anywhere here on the abdomen, we can go all the way to the love handles, if you will, on the side of the stomach. All right, so now we're going to prepare our site, and we're going to make sure we clean thoroughly. So this can be kind of cold for your patient, so make sure you scrub and clean your site appropriately. Then when we go to give the injection, I'm going to grasp the patient's skin and where I'm going to inject. So when I do that, I don't need to pinch really hard or pinch really narrow because I don't want to get my fingers in the way. I also don't want to make it painful for the patient. All right, so now let's also talk about the angle. Now my patient's at a healthy weight, so here we're going to go at a 90-degree angle. If my patients may be emaciated, malnourished, or have very little adipose tissue, we may need to consider going at a 45-degree angle. But for this demonstration, my patient, we're going to use a 90-degree angle, which is appropriate. All right, so now let's get ready for administration. Now this particular syringe I have in my hand, notice the orange cap. Now the great thing about this is universal for the sign that it's an insulin syringe. So you should only have insulin in an insulin syringe. So it's a little bit different for the fact that this is counted in units when you give insulin. So again, it's really important to pick the appropriate syringe for the right medication. All right, so notice that orange cap, think insulin. Okay, so now we're going to remove our cap. Notice when I pull it away from my body. I pull it away from the patient. I'm not pulling it this way, so where I accidentally stab myself. So please make sure you keep this nice and away from you and the patient. So I'm going to move this off and pull. So we also take care not to bend the needle. Then when I position this, everybody holds these differently. I want a nice firm grasp, and also notice how I have it. I want to do it to where when I've got a hold of that needle, I'm going to make a dart-like motion for our patient. So this is important because a lot of the times when we go to inject, we're very nervous about hurting the patient. Think about this as a needle. We want it to pierce the skin. It's nice and sharp, so don't forget about that dart motion anytime you give an injection. So don't forget to dart. All right, so now I'm going to take my non-dominant hand. I'm going to plump up the skin or the site just to give me a landmark and also make it a little bit more comfortable with my patient and go and inject. All right, I'm going to go ahead and give your insulin, sir. So notice I darted. Then I'm going to inject my medication, and now I'm going to slowly remove it, and then I can release the skin. As soon as I've injected, I want to make sure to activate that safety mechanism immediately. Now, I'm using this on the bedside table. This way it stays away from me, my patient. Also, notice we heard that click. That's the best way to know that it's locked and safe. So watch this. That's what we want, so this doesn't slide down and we know the needle's protected. Then after that, we want to make sure that we make sure the patient's not bleeding. Typically with a subcutaneous injection, they don't need a Band-Aid. We are not going to massage the site, and then we want to provide privacy back. Thank you so very much. And then provide patient comfort. Let's talk about some special considerations in regards to the subcutaneous or subq injection. So looking at the do's and don'ts of subcutaneous administration, let's first look at the things we don't do. Let's not massage the medication into the subcutaneous later. This is particularly important with any sort of blood thinner given for DVT or blood clot prevention. This is a common medication you're going to give in clinicals. Give me an example of this is when I give a subcutaneous injection of a blood thinner in the abdomen. As soon as I give the medicine, I want to teach my patient, and I also as a healthcare provider do not want to massage that site. That can cause excessive bruising and complications for your patient. Next, with a subcutaneous injection, you do not want to aspirate for blood when giving this type of injection. All right, let's talk about the things that we need to remember that are important and that we do for this injection. One is we want to withdraw the medication right before we go give the medication administration or go give the injection. Reason being is a lot of this medication is very, very important on the dosage, and we want to make sure that as soon as we draw it up, we go give it. Also, make sure you teach your patients and you as the nurse rotate sites for injection. This is a key teaching point for our diabetics. Let me give you an instance for that. If I have a newly diabetic patient or even a patient that's been diabetic, it's important for us as nursing to teach them that they need to rotate injection sites every time they take an injection. Reason being, if we keep poking the same spot and delivering medication there, malabsorption in that area will occur. The patient will not get the full absorption of all their meds. Therefore, we want to teach them, make sure you rotate sites.